Patients can be afraid to have a joint replacement just because it does affect their activities of daily living. There is a reason in which they're choosing to have that surgery. They can be afraid post-operatively not to get back that same mobility that they had pre-operatively. There is also an anxiety associated with having any surgical procedure, including that of an orthopedic one.
But at times, you'll run into certain individuals who are more anxious than others. These are usually people who have never had a procedure before, never undergone anesthesia before, never been admitted to the hospital before, never had any kind of surgical procedure, even on an ambulatory basis. Typically, I'll take a patient like that and give them the phone number of 2 or 3 patients just like them who've had the procedure within the last few years. And that'll go a long way to allay people's fears. So with regard to hip replacement, if a patient is afraid of the pain that they're going to have along with the surgery, I remind them of the data that we have that shows very often within 2 or 3 days, their pain is actually less. Now on the knee replacement side, typically those patients have a little bit more pain and swelling around the time of surgery. And the reason for this is because the knee is just anatomically disadvantaged from being in an area where it's not really able to swell very much. And when it does swell, which happens with every joint replacement surgery, that's naturally uncomfortable, sometimes downright painful. When patients are anxious about that, I'll talk to them about our pain regimen that we have introduced, which have gotten the pain way down such that a significant portion of our knee replacement patients are going home on the same day of the surgery. So every time someone's getting ready for a joint replacement surgery, we'll have at least a short conversation about the potential complications. And patients' fears are usually allayed by the fact that and if you add up all these different potential complications, the incidence is very low. So at times, patients have excessive fear or anxiety about the unknown, what's going to happen at the time of their hip or knee replacement surgery. And for those patients, I would highly recommend that they just take the time to ask their surgeon or their surgeon's clinical team about what to expect, because there is a lot of knowledge about this in the office, even if you didn't feel like you got all that knowledge the first time you met.